Here to discuss, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases at the NIH and a key member of the White House Coronavirus Task Force. Dr. Fauci, good to have you back. I do have to ask you about this Trump campaign advertisement where you're on camera saying, quote, "I can't imagine that anybody could be doing more." You quickly came out with a statement that noted that that sentence had been taken out of context. You were talking about the whole of government response, not President Trump. And of course, you've never endorsed a presidential candidate in your 5 decades of public service. Should the Trump campaign take this ad down?
You know, I think so, Jake. I think it's really unfortunate and really disappointing that they did that. It's so clear that I'm not a political person, and I have never either directly or indirectly endorsed a political candidate. And to take a completely out of context statement and put it in, which is obviously a political campaign ad, I thought was really very disappointing.
What would you say if I told you I heard that the Trump campaign was actually preparing to do another ad featuring you?
You know, that would be terrible. I mean, that would be outrageous if they do that. In fact, that might actually come back to backfire on them. I hope they don't do that, because that would be kind of playing a game that we don't want to play. So I hope they reconsider that. If, in fact, they are indeed considering doing that, I hope that they reconsider and not do that.
Let's talk about the pandemic, because right now President Trump is getting ready to leave for Florida. That's a state that has an 11% positivity rate. That's pretty high. Any minute he's going to go there to hold an outdoor campaign rally. Now, you called the Rose Garden event 2 or so weeks ago a super spreader event. No distancing, very few masks. We know the previous Trump rallies in Tulsa, Oklahoma, and Minnesota have led to infections and illnesses, possibly even death. We know the Trump campaign does not require masks. They do not require distancing. As a public health matter, how worried are you about these rallies that the president is kicking off?
You know, Jake, I'm glad you used that word as a public health matter, because put aside all of the issues of what political implications a rally has, and just put that aside and look at it purely in the context of public health. We know that that is asking for trouble when you do that. We've seen that when you have situations of congregate settings where there are a lot of people without masks. The data speak for themselves. It happens. And now is even more so a worse time to do that, because when you look at what's going on in the United States, it's really very troublesome. A number of states right now are having increase in test positivity. States above the Sun Belt, states in the Sun Belt. If you look at the map with the color coding of cases and states that are going up, you see states in the Northwest and the Midwest. It's going in the wrong direction right now. So if there's anything we should be doing, we should be doubling down in implementing the public health measures that we've been talking about for so long, which are keeping a distance, no crowds, wearing masks, washing hands, doing things outside as opposed to inside in order to get those numbers down. We're entering into the cool months of the fall and ultimately the cold months of the winter. And that's just a recipe of a real problem if we don't get things under control before we get into that seasonal challenge.
President Trump says he's immune to the virus because he has survived it. His physician, Dr. Sean Conley, gave him the okay to travel. He says the president is no longer considered a transmission risk. Conley did not say the president has tested negative. Now, I know the CDC does not say that testing negative is required before somebody is allowed to travel and be around others. Can you explain that to us? Why not?
Well, you know, it just goes to what's practical in the community. They have found that if you are 10 days from the onset of symptoms, the chances are extraordinarily low that you are going to be transmissible, that you would be able to transmit it. If you really want to nail it down, you do a PCR test and you show that the person has a level of virus that's not going to be transmitted. And that's what you can do sometimes. Whether they do that or not, that remains to be seen. But the president would be well within the 10-day time frame of being non-transmissible.
What about him saying that he's immune because he has the virus? Is the science conclusive on that yet?
Well, you know, the problem with the word immune, it means different things to different individuals, Jake. If he means that he's been infected, and having been infected and recovered, that he will not get infected again, that's true for a limited period of time. What we do not know is how long that protection lasts. So technically speaking, the fact that he has recovered from an immunological standpoint, he has an immune response in him that very likely would protect him from being reinfected. But we've got to be careful about that because we're starting to see a number of cases that are being reported of people who get reinfected, well-documented cases of people who were infected after a relatively brief period of time, measured anywhere from weeks to several months, come back, get exposed, and get infected again. So you really have to be careful that you're not completely, quote, immune.
I want to talk about this idea of, like, once you're past that 10-day period of showing symptoms, you're likely not contagious anymore. Given that there's so much we still don't know about this virus, would it not be better for those who have been infected? I'm thinking right now specifically of Senator Mike Lee of Utah, who was maskless at the Supreme Court confirmation hearing today. He said that he produced a letter showing that he's outside the 10 days, and the doctor gave him the all clear. But I have to say, I don't know that I would feel comfortable sitting next to him so soon.
Right.
Wouldn't it, in the name of being better to be safe than sorry, wouldn't it be better for President Trump, Senator Lee, to wear masks and limit their exposure to others, even if they're past the 10 days?
Yeah, I mean, as the better part of caution, I think that would be appropriate to do that. I mean, I certainly think from a practical standpoint, I probably would do that myself just to be extra careful. But the thing that you mentioned just a moment ago of doing an actual test to look for the level of virus and viral remnants would probably get people to be feeling much more comfortable about the lack of transmissibility. And they very well may do that to just go that extra step to show that an individual, whoever that might be, the president or anybody else, a senator or anybody, to just go that extra step in addition to the 10-day period to show that the virus itself is not present in a form that would be transmissible.
We're going to squeeze